Medicaid at the American taxpayer's expense. Joining us now is Administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, thanks for joining us.
Thanks, Ainsley. You know, the Democrats have been gaslighting us on this issue of Medicaid funds going to illegal immigrants for quite a while. When the president came into office, he insisted we take the fraud, waste, and abuse out of the system. And that's why the One Big Beautiful Bill has provisions to do just that. The shutdown, as you know, is in part because the Democrats want to repeal that landmark legislation. And they keep claiming that there is no money going from Medicaid, an agency that I run, towards illegal immigrants. So we decided to do our homework. We sent our best investigators out to evaluate exactly what is going on. And I'm here to announce, Ainsley, and this is a big deal, that just over the last few months, we have proven that there's been over $1 billion. That's a billion with a B. It's a lot of money. It's not a rounding error. $1 billion paid by U.S. taxpayers for illegal immigrants in about half a dozen states. And we're just getting started. So it's going to be significantly more money than that. And just to break this down for everybody, Ainsley, if you live in Texas or Florida and you're paying U.S. federal taxes, most people do, your money is being diverted to places like California who have robust benefits for illegal immigrants, you know, dental, vision, things you don't even get on Medicare. And those funds we have no ability to track until today. Now we're investigating it, and we're going to continue to track this across the country.
So is that going to continue under the Trump administration? How can we stop this from happening?
Well, the legislation allows us to do just that. We are no longer obliged to pay for illegal immigrants in states that decide that they think are the largesse of their hearts. They want to fund those programs. If you want to fund full dental, vision, and robust health services in, for example, California or Illinois or New York or Minnesota, that's your choice. If you want to do that, you have to pay with your own state income tax. You can't use federal dollars for that, and so we are clawing that money back. Some of these states have already, they know they're guilty. They begin to pay the money back already, and we will get all that money back into our federal coffers. The president is laser focused on protecting the U.S. taxpayer. But Ainsley, this raises a bigger issue. Why are we shut down? The people who should be doing these investigations, the folks who can solve some of the problems we're having to improve the quality of care, for example, health care in this country, but many other services are being compromised by a shutdown that's based on false information. There is money being given to illegal immigrants on Medicaid. Again, Medicaid is designed for our most vulnerable, Ainsley. It's designed for our kids, for our elderly, folks who are struggling with significant health issues. They need those funds. You can't just dole that out to able-bodied illegal immigrants in states because they think it's the right thing to do. If they want to pay for it, they should pay for it.
Please send this memo, this study, to Chuck Schumer so that he sees what he's been saying, that they're not going to benefit, illegals are not going to benefit. That's not the case. We have the proof. Let's talk about MAHA, because Washington Post has this poll where there's bipartisan support from parents to crack down on processed foods and dyes and added sugars. But the MAHA movement is only getting 38% support. Look at this. Supporters of the MAHA movement, total parents, 38%. Republican parents, 62% like MAHA. Democratic parents,